and social reform in the Progressive Era. One of the labor and social reforms in the Progressive Era was the child labor. Although children had been servants and apprentices throughout most of human history, child labor reached new extremes during the Industrial Revolution. Children often worked long hours and dangerous factory conditions for very little money. Children were useful as laborers because their size allowed them to move in small spaces in factories or mines where adults couldn't fit. Children were easier to manage and control, and perhaps most importantly, children could be paid less than adults. Child laborers often worked to help support their families, but were forced to forgo an education. 19th century reformers and labor organizers sought to restrict child labor and improve working conditions. Another labor and social reform in the Progressive Era was the public health. The greatest challenge during the Progressive Era was the health of its people. Some of the most serious problems were caused by living conditions. Almost all of the state's rural homes, and many of those in its cities, lacked any means of sanitary sewage. Impure food, ignorance of the contagious and infectious nature of illnesses, and inadequate medical assistance added to public health risks. Solving these problems in the long term would involve a combination of education, medical science, government support, and access to health care. Georgia's first serious step was taken in 1903 when the General Assembly created a new state board of health.